Namaste and good evening. Welcome to Easy Ayurveda Gurukula episode 31. Hearty welcome to all the participants, Easy Ayurveda family. Today we have Dr. Rajni Angadi with us for her presentation. Before starting the session, let me have the privilege of introducing our speaker, Dr. Rajni. She has completed her UG from Sri Basveshwara Ayurvedic Medical College and Hospital, Bagalkot. Currently pursuing final year post-graduation studies at Department of Kai Chikitsa, A.L.N. Rao Ayurvedic Medical College, Koppa, in Karnataka. So she was awarded with the Ayur Visharada Award in the year 2019, and she holds the first university rank during PG course in the year 2021 in the Department of Kai Chikitsa. She has assisted and conducted many procedures, including Agni Karma, Sira Veda, and Basti procedures. Very much interested in the clinical interventions and also the presentations. Worked at Sri Sai Hospital, Vijaypura. So she has presented a few papers, good papers at national and international levels. National level seminar, Trivida Pariksha and its importance, and Patya Apatya Vivechana and its application. International seminar she has presented on preconception care through Ayurveda. She is currently doing her thesis on a topic, interesting topic again, a randomized comparative clinical study to evaluate the efficacy of Atarushadi, Kwatha and Durvyadi Taila in the management of Vicharchika. So today Dr. Rajni will be presenting an interesting topic to us. So on behalf of all of us and Easy Ayurveda, so may I extend a cordial welcome to Dr. Rajni. Dr. Rajni, namaste and welcome to Easy Ayurveda Gurukula session.
Thank you, sir. Yes, sir. Thank you for the introduction, sir. It's a privilege of presenting here. I would like to thank Easy Ayurveda Gurukula session for giving me an opportunity to share my thoughts. And secondly, I would like to thank Raghuram, sir, for giving me an opportunity. Thank you, sir. My topic of presentation is Understanding Ekakustha Psoriasis through Case Studies. Contents of the presentation: brief introduction to the Ekakustha, Nidana Purvarupa, Rupa Lakshanas, types, general line of management, Ekakustha Lakshana, brief introduction to psoriasis, case with intervention used, probable mode of action of intervention, conclusions. Introduction: we consider skin as the one among the Pancha Indriyas. So, as it affects the person both mentally and physically. All the skin diseases in the Ayurveda are discussed under the broad heading of Kushta, which are further divided into Mahakushta and Kshudra Kushtas. So it mainly involves the doshas of Vata Pitta Kapha, doshas of Tvak Rakta Mamsa Lasika. Moving on to the definition, one which causes a despicable situation is called as Kushta. Nirukti is Nishoshana Vilekhanam in the Anga Pratyanga, that is called Kushta. Prevalence of the Kushta is among 125 million people worldwide. 2 to 3% of total population have psoriasis according to World Psoriasis Day Consortium. Prevalence rate is 0.44 to 2.8%. Nidhanas, here we consider mainly the Nidhanas which are being, as I'm considering the Ekakustha. So the Nidhanas which are mainly triggering the Ekakustha will be considered here. So Nidhanas considered are Ajirna Adyashana, Navannapana, Dadi Matsya, Atilavana, Amla, Dishevana, Masha, Mulika, Pishtanna, Kshira Guda, and immediately to the sleep is the main reason. And Nindita of the Guru and Papa Karma are considered here according to Charaka Samhita Chikitsa 7 chapter 8 shloka in detail, like eating uncooked raw foods, cold water immediately after exposure to the sun, exertion, fear, restricted Panchakarma diets are not being followed. Moving on to the Samprapti, the vitiated Tridoshas like Vata Pitta Kapha along with impaired Tvak Rakta Mamsa together constitute 7 essential entities which play a pathogenesis in the Kushta. So the Nidana Seva activated, and there will be Shariravat Sanchara of the doshas. They get accumulated in the Tvak Rakta Mamsa. There will be Kledotpatti, and there will be symptoms of Ekakustha, especially Asvedana, Mahavatsya and Matsya Shakala. Next, moving on to the Purvarupa, there will be decreased touch sensation, excessive sweating or absence of sweating, change in the color, papules on the skin, pruritus, pricking pain, mental fatigue, severe pain in the ulcerated area. Dosha Lakshanas, specifically in the Kushta, not considering only Ekakustha, specifically overall in the Kushta. In Vataja, there will be Rukshata, Shoshata, Shula, Sankocha, Arushya, Harsha, Syava, Arunavarna. In Pittaja, Daha, Raga, Paka, Visragandhi, Kleda. In Kafaja, Shweta, Shaitya, Kandu, Gaurava will be present. Sapta Dhatu Ashraya Kushta Lakshanas are being mentioned based on the Dhatus. Tvak, there will be Toda, Vaivarnya, Rushatva will be there. In Rakta, Sweda, Shwayatu will be there. Mamsa, Spota in the Pani, Pada, Kledata in the joints. Medas, Gatikshaya for the Angas. Asti and Majja, Nasa Bhagna, Netra Raga, Swarakshaya, Krimi in the Vrana will be present according to Ashtanga Hridaya. Types of the kushtas, totally we have 18 types of kushtas as mentioned by the Acharyas. Mainly Mahakushtas are of 7 types and their doshic predominance are being explained simultaneously. And Kshudra kushtas are of 11 types and their doshic predominance are being explained. Samprapti Ghatakas of kushta, dosha is Vata, Brajaka Pitta, Dhatu, Rasa, Rakta, Mamsa, Upadhatutvak, Agni, Jataragni, Dhatvagni, Mandya, Shotas, Rasa, Rakta, Mamsa, Shotadushti Prakara, Sangha, Udbhavasthana, Amashaya and Pakvashaya, Pancharasthana, Sarva Sharira, Adhisthana, Tvak, Rakta, Mamsa, Lasika, Vektasthana, Tvak, Roga Marga, Bahya, Swabhava, Chirakari, Sadhya, Sadhita, Krichra, Sadhya. Moving on to Ekakushta. Ekakushta is considered one among the Kshidra Kushta. So it is having the Lakshanas of Asvedanam Mahavastu, Matsya Shakalopamam. Looks like the scales of the fish. The person doesn't get sweat in the affected area. That sensation will be rough and coarse on touch, extensive in the size, and developed with the vitiation of Vata and Kapha dosha dominance is present in this Kushta. So parameters considered in Eka Kushta are mainly subjective parameters are Matsya Shakala, Asvedana, Mahavastu, and objective parameters are candle grease sign, auspicious sign, and Kobna's sign. Candle grease sign is nothing but when we scratch over the area, there will be formation of waxy-like formation over the area. Auspicious sign is whenever we take off the lesion, there will be bleeding spots on the scales. And Kobna's sign is whenever we scratch on the area, whenever there is a new lesion formation on the area, so there will be scratching, the Kobna's sign is present. Moving on to differential diagnosis. So Ekakushta, Sidma Kushta and Kitiba Kushta are being almost considered same. So they will be having the difference in the clinical features. In Sidma Kushta, Shweta Varna, Tamra Varna, Tanu, mostly on the chest part, and Kitiba Kushta, Shavata, Kinakara Sparsha and Parushata will be present. Samanya Chikitsa Sutra mainly considered is Vatottareshu Sarpi Vamanam, Shleshmottareshu Kushteshu, Pittottareshu Moksha Raktasya Virechanam Chagre, according to Charaka Chikitsa 7th chapter. Here, Sarpipana is given in Vata, Vamana Karma in the Kapha, and Rakta Mokshana and Virechana in the Pitta. So main treatment protocol, what we are being considered here in general line of management is mainly Samsana is the first line of management. After Samsana, we can opt a treatment of Pachana. After that, followed by Deepana, followed by Snehana, Shodhana, then Shamana, then Rasayana Chikitsa or Brahmana Chikitsa can be taken. In Ashtanga Hridaya Chikitsa Sthana, Acharyas have mentioned proper time for going for the Shodhana therapies. So in Vamana, Pakshat, 15 days gap is given and then Vamana is being done. In Virechana, Mase, every month we can go for Virechana. Rakta Mokshana, every 6 months, we if the person is suffering from the Kushta, he need to go for Rakta Mokshana at every 6 months. Nasya Karma, every 3 days. That is being mentioned in Shushruta Chikitsa. Moving on to the Sadhya Sadhata. Sukha Sadhya is Eko Deshat Bhava, Tvakashraya and Kafavata are Sukha Sadhya. Pittaja, Dvidoshaja and Rakta Mamsa are Krichra Sadhya. Medogata Kushta are Yapya. Asti Majja Shuklagata Samshraya Kushta are Asadhya. And this is normal anatomical condition we can consider. So the normal skin and psoriatic skin. Here the scales, inflamed skin lesions and plaques are present on the keratin layer. So the difference can be seen. Next, as the Eka Kushta can be treated through the Ayurveda and considering the psoriasis as the last platform. So here Ekakushta symptoms which are present, which have been mentioned by Acharyas, are being found in the psoriasis. Those symptoms are correlated here. So here psoriasis is taken. So psoriasis, inflammatory and hyperplastic disease of the skin, it is being considered. It is chronic and relapsing in condition. Psoriasis, it is nothing but inflammatory hyperplastic disease of the skin characterized by erythematic elevated scaly plaques. So symptoms of psoriasis considered are scaling is present, itching, skin redness, tightness of the skin, bleeding, burning sensation, and fatigue will be present. Causes and common triggering factors are almost similar. So here infection, skin trauma, psychological stress, drugs, sunburns, metabolic factors, hormonal changes are the common triggering factors. Apart from that, obesity, endocrine disorder, alcoholism, stress, medicine can be considered as the causes. Clinical presentation of psoriasis, classical psoriasis is, it is defined and sharply demarcated, round or oval in shape, usually symmetrical, erythematous raised plaques covered by white and silvery scales. Presentation, it is present especially over scalp, elbow, knee, sacrum, head, but the extent varies from types. And moving on to the types of psoriasis, chronic plaque, guttate, flexural, erythrodermic, pustular may be localized or generalized. Local form are palmoplantar psoriasis, scalp psoriasis, and nail psoriasis. So these are the images of psoriasis. This is chronic plaque psoriasis. Second is guttate psoriasis, erythrodermic, flexural psoriasis, pustular, palmoplantar psoriasis, nail psoriasis, and scalp psoriasis. Not going much in detail. Plaque psoriasis is well-defined, raised, red, inflamed, present with characteristics of itching and burning. Guttate psoriasis is discrete, small red spots. Flexural is smooth, dry, red, inflamed scales. Erythrodermic, entire body will be present, and severe itching, burning sensation, peeling will be there. Generalized pustular, pustules on the erythematous skin. Localized pustular is pustules on the head and feet. Nail psoriasis, pitting of nails, thickened nails, discoloration of nails will be present. Palmoplantar psoriasis, present on the palms and soles. They are hyperkeratotic or pustular, possibly aggravated by trauma. Scalp psoriasis is their erythematous, and with the scaling they are present. Diagnosing the psoriasis mainly based upon the history, distribution of the lesions, family history, and considering the point that non-cutaneous complications are to be kept in the mind while diagnosing. Differential diagnosis of psoriasis is localized patches or plaques. In that, tinea, eczema, superficial basal cell carcinoma, and Bowman's disease. Seborrheic dermatitis, cutaneous T-cell lymphoma, flexure, tinea, eczema, candidiasis, seborrheic dermatitis. Guttate, pityriasis rosea, drug eruptions, secondary syphilis may be the reason. In erythrodermic, eczema, cutaneous cell T-cell lymphoma, pityriasis rubra, lichens planus. In palmoplantar psoriasis, tinea. So determining the severity score in the psoriasis. So PSI score is being taken. Here, a PSI score indicates the severity of the disease. Single number can be taken. So here 4 distinct areas are being considered. That is head, trunk, upper limb, and lower limb. Score ranges from 0 to 72. 0 is considered as no disease, and 72 is considered as maximal disease. For calculating ABCD, 4 criteria are being taken, and they are being multiplied, and we'll get a final 1-digit number. So before and after treatment are being taken. Managing the psoriasis, establishing the relationship of the trust with the patient, providing the patient with the basic information regarding its chronic recurrence, and emphasizing the nature of the disease. Treatment, generally not going in detail, superficially we can consider like eliminating potential triggering factors, topical therapies, phototherapies, and systemic drugs are being taken, and biological agents are being considered in the treatment. So moving on further to the case studies, here Ekakustha studies are being taken. So this is the first case, and this is before treatment, IP treatment, before patient was getting admitted. And the second photo is of during treatment, and after is of during the discharge of the patient. Here in this first case, PSI score, which was 11.3, was being reduced to 6.2. So moving on to the case in detail, it is a 35 years female case of presentation of psoriatic lesions on the scalp with increased discoloration since 2 years. Sleep was disturbed in the patient, and bowel 1 in 2 days with constipation. On examination, Candle sign was positive, Auspich sign was positive, Cobnus phenomenon negative, discoloration was grade 2, and itching was grade 3. The patient had complained of so much of itching that she couldn't sleep at the night. That was the condition of the patient when she got admitted. Treatment advised was Sarvanga Kashaya Dhara, Shirodhara on the day of admission. On the second day, Shirobhyanga and Sarvanga Abhyanga, followed by Bashpasveda in the morning. Afternoon, Sarvanga Kashaya Dhara and Shirodhara. Then on 3 days, this treatment was being continued, and on the 4th day, Snehapana was being started by deciding the dose based on the patient's Agni and Koshta. Snehapana, 30 ml of Mahatiktaka Grita was being administered. Along with, due to severity of itching, Shirothakradhara was being advised to the patient in the evening. And Snehapana on the second day was 60 ml. With the same Panchakarma procedure, and it was on the 18th of the date, it was 100 ml. On 19th, 120, and on 20th day after 140 ml, the patient had Sneha Siddhi Lakshanas, and after that, a gap of 1 day on 21, Sarvanga Abhyanga with the same oil followed by Bashpasveda and Shirotakradhara was being carried out. And on the last day, Sarvanga Abhyanga followed by Bashpasveda. Classical Vamana was being carried out, and the Vegas were 5. The drugs administered were Kantapana Kshira, Yashtimadu Fanta, then Vamana Dravyas of Yashtimadu, Madanaphala, Vacha, Saindava, honey was being administered. And after the Vamana, the patient has Vamana was good, that patient was stable and her itching was reduced almost. Then advised on discharge, Sorocot tablet 101 after food, Dermaclean tablet 101 after food, D-Sora soap local application, Nirmal bath powder for local application, Jatyadi ointment local application, Yashtimadu Thaila for local application for the scalp, Panchatikta Kashaya 15 ml BD with 30 ml of warm water was being advised for 15 days. Next, moving on to the second case. So this was the before treatment and after treatment. In this case, the PSI score before treatment was 6.2, which was reduced to 3.2 after the treatment. So second case, it was a 19-year male with complaints of small round scaly patches, lesions on the body, especially over the abdomen and back since 6 years. So he had a disturbance of the sleep, appetite was reduced. Here Candle sign was negative in this case, Auspich sign was positive, Cobnus phenomenon was negative, discoloration was grade 2, itching grade 2, scaling was positive. And a treatment followed was Sarvanga Abhyanga followed by Bashpasveda, Sarvanga Kashaya Dhara. And on the second day, Sarvanga Abhyanga followed by Bashpasveda, Sadhya Vamana was being carried out. Next, after that gap of day, we had started Snehapana with 30 ml of Mahatiktaka Grita, and Sthanika Abhyanga and Sthanika Kashaya Dhara was being carried out. And simultaneously, after fixing the dosage for the next day, the Snehapana was being carried out along with the simultaneous Panchakarma procedures. So after Sneha Siddhi Lakshanas, Sthanika Abhyanga and Sthanika Kashayadhara was being carried. And after that, on the last day, Virechana was being administered with Rid Virechana Leham of 60 gram with warm water. And before the administration of Rid Virechana, Sarvanga Abhyanga followed by Bashpasveda. Later, Virechana Dravya was being given. And here, 12 Vegas were being found in the patient, and it was indication of Madhyama Vegas. And in this patient, advice on discharge medicines were Pitta Rechaka Kvata 15 ml with 30 ml of warm water before food, Rakamrita Kvata 15 ml with 30 ml of warm water before food, and 777 oil for local application, Amruta Gugulu 101 before food, Avipatikara Churna with the mixture of Anuloma DS tablets at 1 tablespoon at night with warm water, Raktapachaka Vati 101 before food for a duration of 15 days, and patient was advised for the follow-up. So moving on to the third case. So third case, here she is a female of 26 years. She had a complaint of silver color elevated patchy lesions all over the scalp, behind the ears, head, lower back, right knee since 4 years, and itching was so severe over the areas. Dryness with powdery discharge on scratching was present, and increased sweating was present since 6 months. And in this case, Amapachana was followed by Risva Matra Snehapana. After that, Sarvanga Abhyanga followed by Bashpasveda on the day of admission. And second day, the choice of treatment opted was Sarvanga Abhyanga, Bashpasveda followed by Vamana. And after that, on 17 days, Snehapana was started with Panchatikta Gugulu Gruta after seeing the Koshta of and Agni of the patient, that is 30 ml of Snehapana was being advised. After that, Sthanika Abhyanga and Sthanika Kashaya Dhara in the afternoon. Then in this patient, the PSI score, which was 12.6 before treatment, was reduced to 3.5 after treatment. Then Snehapana was being continued for 4 days. After that, on the 19th day, 120 ml of Panchatikta Gugulu Gruta, Sthanika Abhyanga and Sthanika Kashaya Dhara was being given. And here, on last day, Virechana with Rud Virechana, 30 gram with Gandharva Hastadi Pani of 1 liter as Anupana was being given for the patient to drink for throughout the day, and 11 Vegas was being seen. And here after treatment changes found was candle grease sign, which was present before, it was present after also. Auspich sign was positive. Discoloration was reduced. Itching was reduced, and scaling was reduced. Sleep disturbance, which was present before, it was normal, and appetite was okay. Advised on discharge. So for Amapachana, Chitrakadi was Vati was being priorly advised. Mahatiktaka Grita, half tablespoon with warm water on the empty stomach. Panchatiktaka Gugulugruta tablet was given 2 BD before food. Mahamanjishtadi Kada 15 ml with 30 ml of warm water before food. Gandhaka Rasayana, Arogyavardhini Vati night after food. Kadirarishta, Vidangarishta 15 ml BD after food with 30 ml of warm water. Jaffman lotion, local application for every 3 hours was being administered. Chakramarda Taila, Yashti Madhu Taila for local application before bath. Panchavalkala Kwatachurna, Asanadi Kwatachurna for bath. Disora soap for bath for 15 days, and after 15 days, patient was being advised for the follow-up. So these were the changes before treatment and after treatment of the scalp, behind the ears and on the knee. After this case, so these are the medicines which were taken for the chikitsa. So there is general line of management where you can follow a protocol wherein treatment protocol is Sramsana, Amapachana, Deepana, Srodhana, Shamana, Brahmana or Rasayana. So Sramsana is nothing but we can consider that Paktavam, Yat Pakvam, Klishtam, Koshtam, Maladikam. So here Sramsana, it does not do the Pachana of the doshas, it will be expelling the doshas. After that, following Amapachana and giving the Deepana drugs, followed by Shodhana. Shodhana could be Vamana, Virechana or Raktamokshana, based on the days which has been mentioned in the Ashtanga Hridaya priorly. So those days are being considered and Shodhana is being carried out. After that, Shamana followed by Rasayana therapies is taken. And in Rasayana, drugs like Tuvaraka Taila, Chitrakadi Rasayana, Bhallataka Rasa, Bakuchi Rasayana, Shilajit Rasayana, Gandhaka Rasayana are being considered. So these are the drugs. These are some drugs which can be taken based on that protocol. In Sramsana, Mani Badra Churnam, Patola Muladi Churnam, Haritaki Churnam, Avipattikara Churnam. In Pachana, Shadharana Kashaya, Amrutottara Kashaya, Punarnavadi Kashaya, Panchakola Kashaya. In Deepanam, Agnitundi Vati, Chitrakadi Vati, Rashunadi Vati. Snehanam, Abhyantara, Panchatikta Gugulu Gruta, Mahatiktaka Gruta, Tiktaka Grita, Aragvadadi Grita, Gugulu Tiktaka Grita. Snehanam, Bahya, Eshti Madhu Taila, Marichadi Taila, Nal Pamaradi, Ayapala, Murchita Taila can be taken. In Svedana, Mrudu Svedana, Pariseka with Nimbadi Kashaya, Aragvadadi Kashaya or any Tiktaka Dravyas can be considered based on the doshas. Virechana, Trivrutleha, Avipattikara Churna, Manibhadra Guda, Ichabedi Rasa, Eranda Taila, Kalyanaka Guda. Raktamokshana, Jalokavacharana is done in Avaghada Kushta kind of Kushta. Siraveda can be opted in Mahati Kushta, Sarvadahika Kushta. Prachanna in Alpa Kushta and Pindita Kushta. Shringa and Alabu in Tvaksthita. And moving, as Acharyas have not mentioned Basti in Kushta. So if in Charaka and Shushruta, Basti is not is directly contraindicated because it aggravates the Kushta Roga. But in Charaka Chikitsa 7th chapter 46 shloka, it has been mentioned that Astapana Basti can be prepared by adding Snehana Dravyas with Daru, Haridra, Brahati, Ushira and Patola can be taken. So as excess of Vata after administering of Virechana, Astapana Basti can be given and after followed by Anuvasana Basti can be taken. In Anuvasana Basti, Taila prepared with Madana Phala, Madhuka, Nimba, Kutaja, Patola can be added. And Nasya Yogas, in Nasya it has been mentioned by Charakacharya, we can go for Saindava, Danti, Maricha and Karanja drugs can be taken. Takradhara, as it can prevent the proliferation of the cells and enhances the Tvaksarata and reduces the stress of the patient. As Takradhara is, if we opt Shirodhara, then stress will be reduced. So, as one cause for Nidhan of the Kushta is stress, so Sarvanga or Sthanika Takradhara can be opted, and Takra is Vata and Kafahara and Shrota Shodhaka. Dushi Visha Chikitsa can also be adopted. In Vishagna Dashemani, drugs like Haridra, Manjishta, Chandana, Ela, Trivrut and Dushi Vishari Gudika can also be taken. Gutikas, Nimbadi Gugulu, Arogya Vardhini Vati, Kaishora Gugulu, Bilvadi Gulika, Krimigna Vati, Sudarshana Gulika Kashaya, Nimbadi Kashayam, Aragvadadi Kashayam, Patola Muladi Kashayam, Manjishtadi, Tiktaka Kashaya, Vajraka Kashaya, in Grita, Panchatikta Gugulu Grita, Gugulu Tiktaka Grita, Mahakadiradi Grita, Aragvadadi Grita, Patola Gritam, Trifaladi Grita, Dhanvantara Grita, Asavaristas, Aragvadarishta, Kadirarishta, Trifalarishta, Madhvasam, Sarivadhyasama, Lohasava, Lodrasava. These drugs are being chosen based on the doshas involved in the kushtas. Not like all drugs are being taken for all kushtas. If the patient is having the predominance of vata dosha, then vatahara dravyas are being taken. If the patient is having kapha dosha involvement along with the pitta, then pitta kaphahara dosha drugs are being taken. Churnas like Somaraja Churna, Trifaladi Churna, Swarnamakshika Churna with Gomutra, Haridra Kanda Churna. External application, Eladi Churna, Nalpamaradi Taila, Daturadi Taila, Eshtimadu Taila can be taken. Siddharthaka Snana Churna, Panchavalkala Adi Taila, Panchavalkala Kwata Churna can be added for the bathing water and Snana can be done. Marichadi Taila, Jivantadi Yamaka, and soaps are being considered. Disora soap, Sora oil, triple sevel oil, Karchuradi Taila. And in external application, Atrazor ointment, trichoderm cream, which are having the excellent results, even those can be considered. So these are the drugs. These are not the final drugs. We can choose these drugs based on the dosha and general line of treatment protocol. These drugs can be considered and given. So finally, we can come to the conclusion here that the Ayurvedic treatment modalities like repeated Shodhana, Shamana are useful in management of Ekakustha. Dosha involved along with the severity, Agni, Bala, Ama, Avastha of the Vyadhi, Agni Deepana, we can plan for the treatment protocol as Shodhana Shamana play a major role in management of the disease. Samprapti Vigatana is prime consideration in the Chikitsa. By considering the proper doshas, the proper treatment modality should be opted as Virechana Karma is frequently recommended in the treatment of psoriasis, Prakta, Pikta, Agni, Tvak, and Vamana in the Kaphavata conditions. Sadvrita Palana along with Patya is mainly considered in the Kushta. Satata Nidana Sevana is Mula for the Roga, so mainly avoid the Nidanas. Timely Shodhana is required. If not treated, then it becomes Asadhya Vyadhi. Reference taken here are Ashtanga Hridaya, Charaka Samhita and Shushruta Samhita. Thank you all for your kind and patience listening. Thank you, sir.
Thank you. Thank you, Dr. Rajni, for a good presentation. So what was interesting was those case presentations before treatment, after treatment. So this is what we call as evidence-based practice. This is really good how what modalities of treatment should be taken. So I just loved the way the cases were presented, especially the ready reckoners, the tabs which were presented right at the end. Dr. Rajni, so what were the challenges actually you met while treating these conditions? Was it a teamwork or these were the cases handled by self or by the department? So was it, the basic question is challenges met, and was it an individual approach or a team approach towards understanding this disease as well as treating those conditions?
Thank you for the question, sir. Actually, it was a team approach from the Department of Kaya Chikitsa. The consultant, we had the patient for the consultant, and I was there for the follow-up. So the patients which we got in the OPD first setup was first case was of severe. It was a 2.5 years case. It was very chronic that she was not ready to get admitted. And after convincing her for getting admitted and even for going for Shirodhara and all, it was very difficult because of her hairs on the head. Then we advised her for convincing the patient to get shaved off her head. It was a big task, and it was female patient. And after getting cleaned of the hairs, then we went for the Shirodhara simultaneously with the Snehapana. And after that, the result was improved. Priorly, she used to have her sleep just for 2.5 hours after 3:30 till morning 5. And after the Shirodhara was done with the Takra, then she had increased her sleep, that she used to sleep by 11 o'clock and she used to wake up morning in the 7. So that was the changes we found in the patient. And yes, sir. And the treatment, the patient should also follow the protocols which are being advised by the doctors. Even it might be patya, food, post Panchakarma, whatever Sansarjana Krama are being advised, it may be any ganji form of food or anything. So even that matters in the case.
Does the patient look at these things in a harsh way, like this is too much? The
Yes, sir.
doctors. Okay, one thing I understood is the real challenge of shaving off the hairs, especially if it is a female patient. It is a big challenge to convince the patient to shave off the hairs, and ultimately, it's a scenario where we need to manage the things and convince the patient that that is for their better. Okay,
Yes.
so what was the patient experience after? Okay, so that patient could consider it as a sacrifice or something. I am convinced, but to shave my hairs, to remove my hairs, and undergo the treatment. But after seeing the results, what was her expressions and emotions related to the relief?
Rarely she was a bit stressed out, sir. Like hair, especially for a female patient, shaving her hair is a big thing. Then after
Big challenge.
relief from itching, she was very happy that my hair could be grown back. But the symptom relief which I got is really, I couldn't explain it because I couldn't sleep from 2 years. And after this, I could sleep in a calm. So that experience is something she was saying that is new for me. The sleeping thing is that self is a new for me. So
Absolutely. We see this sleep component also when we are discussing about skin disorders like psoriasis. They're very stubborn cases, very difficult to handle. In some cases, most cases, we require the Shodhana and also the external, a comprehensive approach as you have shown in your treatment protocol, be it Shodhana or the combination of Shodhana, Shamana, Rasayana, and almost an aggressive approach. Especially in the third case, what I saw is in the follow-up, you have taken an aggressive approach. There are a big list of medications given to the patient. So the patient would obviously be relieved. Sleep disturbances and the sleep factor and the stress factor. Having seen pretty good number of cases of psoriasis and managing this as a doctor also, it would give confidence that we can handle these difficult scenarios, and seeing the smile on the face of the patient is a different experience for the doctor also, that we have given such a good relief in these cases. And yeah, the contribution of stress and insomnia, sleeplessness, sleep disturbances, how frequently we can see in the skin disorders, and it is really necessary to address those things. Okay, so did you find in not only psoriasis, the other skin conditions which you have seen, the sleep disturbance and stress being a major component, either a causative factor or a trigger or contributing in some way?
yes, sir. As my study is eczema, so all the patients what I have been taken for the eczema, it is sleep or the mental distress is the prime factor, because cosmetically we can consider it as the main thing. It brings depression in the patient to face the society, to face anything. The patient will go to the depression after coming in contact with the person. So that behavior makes the patient to get depressed, to make the patient to feel alone. So that Sattva Vajaya Chikitsa is much needed in skin disease rather than priorly Sattva Vajaya is also needed along with Shodhana and Shamana. Simultaneously it is needed. So
Absolutely, yes. Yeah, absolutely, yes. I agree with that. Dr. Rajni, see, like at discharge, you have prescribed the medicines, okay?
yes,
What is such an aggressive approach required? So, will the patient feel? What's your experience with the patient? Convincing them to take a big set of medications which were written there after all this Shodhana and also the Dhara and almost all the external and internal treatments having been done, the patient may feel. Will there be a question like, doctor, should we take these medicines, all these medicines very regularly? This is a big set of medicine. So was it only an aggressive approach to see
No.
that things don't recur in the follow-up, or what was the idea there?
The patient was from the far out place, as she couldn't come and she stays in a remote area in the field. So she couldn't come for on and often follow-up. And that is the main, and she had other simultaneous complaints also, like she had having her digestion problem, she was having the symptoms of the amla pitta, she had a burning sensation in the chest, and she had the complaint of sleep problem was the main reason in that third case. So that is the main reason consultant had opted for the medicines, and all the medicines that point of time, the conditions were so severe. We had opted for those medications according to that avastha of the disease. And later, when the conditions got relieved, we had stopped that set of medicine, and we had continued the skin medicines on the continuous approach. So that was the thing. Like so many oils were not given at a stretch. So we had advised her to take the oils for local application for first 15 days. And after the completion of that oil, the lotion was being advised. So in that pattern, the treatment was being given.
Okay, so here to make it easy to understand, like you are given a set of medicines, but all need not be used at a time. As and when
Yes.
required, those things are clearly explained to the patient. Okay.
Yes.
How much is a challenge in handling these cases when people come from rural areas, rural setups, and people are not that educated enough to follow the protocol or understand the medication? If that is a problem, how easily you can convince them, or how easily you can make them understand these medicines are very important, but taking which tablet or which kashaya or which grutat, which time. So isn't it a tough scenario there to convince those patients, or to make them understand the methodology of taking those medications in the follow-up?
As we would take the patient's number, then we will be recalling them that this medicine you need to stop, or patient will be in the contact. If not, if patient fails, then with personal interest, we'll be following the case. We'll call them and we'll tell them to take. Then simultaneously, we'll be asking the patient to send the photos before treatment. And if they are not coming for the follow-up in between, then these photos will be collected simultaneously for our knowledge purpose, and to know that what remission or what reoccurrence is being seen in that case. So it is difficult, sir. Sometimes they won't pick the call, they won't respond properly. And when they suddenly come after 2 months, the reoccurrence will be there. So the gap what they had left, they won't be sharing that. They'll be saying that we have come with the symptoms that has been reoccurring. So that's the problem.
Absolutely. That's a big challenge though. So I will take up some questions from the question box, Dr. Rajni. Here, Jai Raghuji's question is, thank you for a nice presentation. So with some compliments to you. My question to you would be, is Ekakustha only manageable, or can it be cured permanently vis-a-vis like psoriasis? So what's your perspective on that?
Can be cured based on the doshas and avastha and chronicity, and in which stage of the dhatu it is being located. As mentioned priorly, if it is present at the site of tvak, it can be cured. If it is at the deeper dhatus, the treatments will be bit delayed, or it can be managed with proper on and often shodhana and shamana is being required. It is not like one shodhana or one shamana could give the response. Repeated shodhana shamana along with patya apatya is can be taken as a choice of treatment.
Absolutely, that's logical, isn't it? Say because Ayurveda also has recommended repeated shodhana. So in kushta, so that's obvious. It is applicable to Ekakustha also. Like repeated shodhana and the follow-ups should be done. So it also depends on the severity of aggravation of dosha, the number of dhatus involved, whether the deeper dhatus are also involved. So whether the marmasthanas are involved. So many factors. The stress factors, the Agni, lot more things we need to see before deciding upon the Shodhana, also whether we need to select Vamana or Virechana, or Vamana and Virechana. So that's right, Dr. Rajni. So all these things, there are many factors to be taken into consideration, and regular follow-up, honesty by on the part of the patient, the understanding of the treatment protocol, understanding that the disease might come back, it has left its footprints, and lot more things is very important. Patient education is quite important. The way you have been explaining the challenges you met in the treatment schedules. So the patient, not only convincing, but also educating the patient is very important. So I think that was a reasonably good answer. So coming to, so one personal question from my side, like you said, you are doing work on eczema. Was it a healthy diversion towards psoriasis, or you just wanted to see if you can take up more than one, or you are relaxed that I am done with my studies on eczema. Let me try on some other cases as well, psoriasis, because we get a lot of cases. So because I know during post-graduation studies, focusing on a particular disease and addressing that and doing our work, so a lot of research and a lot of effort is needed there. You're in spite of you doing work on eczema, so is it by your choice or by your interest, or in the skin diseases that you want to try your treatment protocols on different diseases? Though you said that it was a teamwork and you were a part of the team, but you are like emotionally connected with the skin disorders. Like tomorrow you will go and become a good dermatologist. We have a go-to person.
Thank you for the question, sir. As my thesis was on skin disease and moreover psoriasis, the case we get here are of different types of psoriasis. So that was experience for me to explore the things, that what kind of treatment can be given in what psoriasis and what similar treatments we can get in the OPD setup. And out of interest, as my thesis is there, so that attachment was there much on that side. So I was just on a follow-up side, and it was a teamwork too, sir. And so we did it.
Thank you there for your honest reply. Sunetra ji comes up with the question. Dr. Rajni ji, can the treatment protocol be applied for eczema as well? That's connected to my question as well.
Thank you, sir, for the question. As eczema is also a disease with the involvement of Vata Kapha dosha only. So here same medicines can be used, but along with that, Rakta Mokshana is main line of management we can consider. It might be Siraveda or Jaloka in the eczema after Shodhana Shamana, or prior to the Shodhana Shamana, if patient is okay with that, after Amapachana and all, if on instant also we can use Siraveda or Jaloka for the patient if the condition is severe. Based on the patient's conditions, we can opt for any kind of Shodhana. As these Shamana medicines which have been mentioned for Ekakustha, the dosha involved in Ekakustha and eczema are similar, we can go for that. It can be taken, sir.
Okay. So maybe a small deviation from your from this current discussion. But what's the results of your medicine that you have been using for eczema in your study?
We had 30 patients in a group, in Group A and Group B. And in Group A, we had administered Atarushadic Vata, and in Group B, Atarushadic Vata with Durvadi Taila was being administered. So the Taila with Vata had more result compared to only Taila. So here the symptoms which I got reduced was Kandu, and Strava was on more of a greater extent of relief was seen in the patient. Overall, if I take the statistics, itching and Strava was reduced in the patients. So
to get a clarity, was it the dry type? All your studies was on dry type?
Sir, sorry, sir, I couldn't hear the question.
Yeah, was all your were all your studies on dry type of eczema? So like, because you are using oil and the ghee?
No, sir. We didn't. I didn't discriminated that dry eczema only taken for the study. Dry and wet were taken, and my randomization was not done like dry eczema in this group or wet eczema. It was a block randomization method. I used to take the patients randomly, and what medicines, what groups I used to get, I used to give the patient. If I get the B block patients, then if he has the patient complaining of wet eczema also, I used to give oil and Quata. So that adverse reaction also I could get, that if oil is being applied in the wet eczema,
we have one more question here. What's treatment protocol in dry eczema as well as wet eczema, ma'am? Dr. Shivaleela ji asks this question.
Yes, sir. In dry eczema, as there will be dryness in the skin, so in my study, due to randomization, I couldn't advise the oil for the some patients. So here main line of management will be internally Shamana, we can go for Gritapana, and externally we can go for Taila application, and we can go for Rakta Mokshana in wet eczema cases. So based on the dry and wet eczema, we can go for Taila application. Nothing like Taila application is not only advised in wet eczema, it can not only applied in dry eczema, it can be applied in wet eczema also. So the mode of action of drug to be taken in the consideration, and wet and dry in both the cases, external application can be given. In wet eczema also, the thyla or something external application doesn't mean that we are considering the srava as the main factor. So other conditions also can be reduced through the external applications. So that thought to be kept in mind, and drug to be selected simultaneously, and it can be used.
That's a nice answer, Dr. Rajni. But having said that, in your studies during these eczema cases, have you
Yes, sir.
felt that after seeing some results that if I would have included Shodhana also in these treatments, I would have got a better result? Okay, it's okay that this was my topic of study. After completing my studies, I'll also include Shodhana Prakriyas here and try the same medicines and see if better results can be obtained.
Yes, sir. I felt that I could have got the results on the greater extent, because much of the cases were referred to the consultants. Consultants who had referred me the patients for the trial, and after my trial, the trial period was of 1 month. So after 1 month, I couldn't give the patients the medicines, and after that, consultants were being referred the patients. So there we had advised the patient to go for the Shodhana Shamana, and the duration period was being checked in between. And after that, the relapse of the disease was being considered, and Shodhana was being taken. So Shodhana is needed if in skin disease, especially in the eczema, and if it is of older origin, then Shodhana is must required. Or if it is the Avastha is newer one also, if we are going for the Shodhana in the first stage itself, so the reoccurrence of the disease can also be managed. So if I treat further also, my treatment protocol will be, I'll start with the Shodhana, then I'll go for the Shamana. So simultaneously, I'll choose that, sir.
Taking up the last question from the question box today, Sandy ji asks, Doctor, in case number 2, Snehapana was given the very next day to Sadhyo Vamana. My question is, Patya period is not required in case of Sadhyo Vamana. So like here, I think Sandy ji is pointing towards Samsajana Krama. After Sadhyo Vamana, was Samsajana Krama not needed? Directly you started with Virechana.
Thank you for the question, sir. So here, Sadhyo Vamana was being done, and after that, seeing the time management of the patient and the severity of the patient, its patient's bala was being considered, and the dosage was being fixed based on the Koshta Agni of the patient, and we have started with the Rusva Matra, and seeing that digestion period, second dose was being considered. So if any complications would have come immediately after the next day, we would have taken the gap of 1 day. So the patient's bala was strong, sattva was strong, so we opted, and even time management was being considered. So in that condition, we had opted for second day Snehapana. So that was the protocol and the reason which was being taken here. Thank you for the question.
Okay, thank you there, Dr. Rajni. So, and then you mentioned about the time also there. Time was a factor there. If time
Yes.
allowed, would you have gone for a Krama Vamana and then followed by Virechana instead of Sadhya Vamana?
Yes, sir. Sure, sir. For sure. At least if the patient comes for the first follow-up, we'll try to convince that you go. If they are not willing, then we'll tell them to come. If we are coming for second setting, at least go for the proper protocol of the time being. Almost all the patients were given Snehapana simultaneously with the procedures like Sthanika, Dhara, Sthanika, Abhyanga was being carried out. So that was the treatment opted here.
Vamana was one thing I could see in your case studies. So usually people, the doctors prefer with Virechana, so that even Virechana can be handled at home, like Nitya Virechana or something, some procedures, or it is very difficult to convince people for Vamana. So would you strongly recommend Ubhayataha Shodhana in the management of Ekakustha vis-a-vis psoriasis? So because in my clinical experience also I have seen only Vamana or only Virechana not yielding very good results in psoriasis. Of course, the dharas, takradhara and all those things, the internal medication, the rasayana, seeing the notorious nature of the disease, it has a sense of relapsing and coming and visiting again and again. Okay, so do you strongly recommend after treating these cases that Vamana and Virechana, when we use both these Shodhana Prakriyas in cases of Ekakustha, we can yield better results rather than using Vamana or Virechana?
Yes, so both are simultaneously needed. Ubhaya and Adhomarga Shodhana is needed. In some cases, in last case for Jyoti, we advise the patient to take GH capsule at the home if she couldn't come to the OPD. So for that reason, we have given the.
If you can expand GH capsule for our viewers.
Gandharva Hastadi capsule, we can say. It is the combination of Gandharva Hastadi Taila, which can be used in the Virechana. For it is not the proper Virechana, but a kind of Sramsana, we can say, wherein without the Pachana, the drug, the doshas can be expelled out from the body at a regular interval. So that is not a procedure wherein the treatment can be taken in the IPD setup. At least we can keep the patient in touch, and we can ask the patient to be in contact. So we can be in, so if any complication occurs, so we'll be there to help the patient. So in that last case, we had advised the patient to take the Gandharva Hastadi capsule at an interval of 15 days, so that that Shodhana prakriya will be continued. So in same case, Vamana is needed in, so it is needed in IPD setups. That is for sure. So it can't be done in home. And both Shodhana, Ubhaya and Adhomarga Shodhanas are required, along with Raktamokshana also is needed in the Ekakustha.
Thank you. Thank you so much for the clarification. Dr. Rajani, finally, your tips to any patient whom you have discharged. How best efforts they can put to see that, because this disease has a relapsing and recurring nature. Your best tips to the patients at discharge, how they can prevent the recurrence of psoriasis.
Thank you for the question, sir. First is Nidana Parivarjana is the main that can be done by the patient, along with proper medication. So and follow-up is required, and Shodhana is also needed. It's not like the disease is not relapsing and the patient will take a gap of a year, and when it gets reoccurred due to some nidhanas, then patient will come कि डॉक्टर जी हो गया अभी रिलैप्स हो गया अभी क्या करें. तो it's better कि आप you have to come to the OPD on a regular interval, get Shodhana, and that could be managed with Patya. So that is the choice, sir.
Well, thank you, Dr. Rajani, for your wonderful presentation and answering all the questions in a comprehensive way. So for your expertise and treating the diseases with effective protocols as evitable by your before treatment and after treatment pictures. This generates a lot of confidence in our young doctors who can see this and gain some confidence that we can treat the toughest of psoriasis cases. Thank you for your presentation. On behalf of all our participants and Easy Ayurveda family and team Easy Ayurveda, a big thanks to Dr. Rajani. Thank you, Dr. Rajani.
Thank you. Thank you.
A big thanks, loads of love and namaste from Easy Ayurveda. Namaste.